Today we're going to talk about frozen shoulder, adhesive capsulitis. So in the next couple minutes, we're going to go over a quick overview. The shoulder joint's kind of complicated. This condition isn't very complicated, but it's weird. My name is Dr. Walsh. I'm over here at Walsh Chiropractic and Physical Therapy in Hagerstown. Frozen shoulder is an inflammation of the shoulder capsule. And this is the shoulder capsule. You can see where it's not inflamed and inflammation right there. It's so well depicted in the drawing. It's a joke. The shoulder is not truly a great joint. Actually, if you remember the 7 simple machines in physics, the lever is one of them. This is the reason why the lever works, is why the shoulder becomes so vulnerable. Because if you remember, in a lever stick, right, the load is here, the fulcrum, you need less force. Well, the problem is the fulcrum is next to the load. In the shoulder, the fulcrum is next to the force. So what it actually does is multiply what's in your hand on the shoulder joint. That's why it's very vulnerable. So that's why proper posture and proper form are very important in any physical activity. Okay. So with the shoulder joint, you have rotator cuff muscles, 4 of them, and they attach. They help hold it in. You've got a labrum. They make up the capsule. You've got different ligaments and tendons in there, all trying to keep that bone in that socket, right? Because if you take a look at the glenoid fossa, it's very flat. It's very flat. And you got this round, they call it, a ball joint, but it's very flat. It's the soft tissue that holds it in together. All right. And this is an inflammation of the connective tissue that holds that joint. So what happens is basically that becomes inflamed. It's very painful to move the joint itself. You have very limited range of motion, but it does have typically its own cycle in which it heals. In about 2 years, if you do nothing, in about 2 years, it should improve. It should go away. It goes supposedly. Okay. I don't know if it ever truly totally goes away. Every patient that I've had, it's never the same totally. And that's because of the fact that you didn't do some of the work after. You did nothing different. You just let it run its course. Because it is connective tissue, it means it's avascular. Now, what happens with avascular tissue? It doesn't have a direct blood supply. Therefore, the nutrients in blood for healing is not direct. It has to get its nutrients through diffusion, through whatever it's attached to that is vascular, bone, muscle. Okay. In ligaments, there is no muscle. It's all bone. And for it to diffuse to the injured area, it has to go through every cell in between the connection and the injury. And they've got to become sated before it can pass on nutrients. It takes time. This is roughly 2 years if you do nothing. Typically, you can improve on that. Chiropractic, what we do is we adjust the joints. We do a couple. Right off the bat, first stage, the critical stage, you don't do too much. Whenever tissue, muscle, ligament, tendon, connective tissue, fascia is torn, you don't want to go directly into exercise. Even though some say, go ahead and do some, no, I don't. And you got to watch the stretching too, because it's already torn, right? So if you stretch torn tissue, what can happen? You can tear it more. So don't do that. Typically, what we want to in the critical phase is we want to get you out of discomfort as quickly as possible. So we do some soft tissue work, we adjust, we could do dry needling, we can do some electric stim. Now I like dry needling, even though it's a soft tissue technique, just like ART, IMGT, different types of even therapeutic massage. They're all the same thing. What you're actually doing is you're going in there and tearing tissue. What makes dry needling different is that you're not tearing any tissue. You're eliciting the healing response, right? Because when you're tearing tissue up, there's 2 things that are happening, right? So I got tight muscles, you go to a massage therapist or IMGT, chiropractor, it doesn't matter. And you're doing soft tissue techniques. What you're doing is you're loosening up that tissue. And sometimes loosening up the tissue, you're gonna tear it. And that's okay, that you don't over tear it and then you get over injured, then you actually have deep bruises instead of, but that little tearing helps free up the tissue. And for healing, it's going to bleed more, right? So you're going to get more blood to the air for healing. Dry needling doesn't tear. You put in these little needles, acupuncture needles, right? You're not moving the tissue, though some techniques you can move tissue underneath with the needle in it, but you're poking little holes in it, which elicits the same healing response with less damage than a lot of those other techniques. Okay. So that's why I like dry needling. Dry needling, at least clinically, what I have seen, it's by far the best soft tissue technique. The problem with dry needling is the fact that insurance companies quit paying for it in March 2020. And now that's all out of pocket. And, just like any other expense or what patients look at as an expense. But, and nothing happens overnight. Everybody, I know when you want to heal, you want to be quick tomorrow. It's not going to happen. The injury can happen that quick, but the healing from that injury takes time, and everybody's different. I always say it's a roller coaster, right? You're not going to go up. The slope of that roller coaster is going to go up, but you're going to have good days, bad days, good days, bad days. And the more you do it, the less intense and the shorter the bad periods become. But as far as frozen shoulder, this basically it's the joint capsule that becomes inflamed and limited motion. What you're going to see is a decrease in motion at first, then increase in pain, then you can't move it past a certain degree, and that's going to be for a while, and then hopefully eventually it can work itself out, and that gives